Certain health changes can quietly appear with age. A little dizziness here, a little fatigue there. At first, they may not seem serious, but doctors say some symptoms that look harmless on the surface can sometimes become important warning signs if they continue or slowly get worse. 1. Weight loss without trying. Losing weight without changing eating habits or activity levels may not seem dangerous at first, but ongoing weight loss can sometimes point to hidden medical conditions, poor appetite, digestive problems, medication side effects, diabetes, thyroid disorders, depression, or certain illnesses may all contribute to unexpected weight loss. Clothes fitting looser, reduced muscle strength, or eating much less than usual can become warning signs over time. Doctors often recommend checking ongoing weight loss early, especially in adults over 75, because the body may be losing important muscle and nutrients without realizing it too. Always feeling tired. Feeling tired after physical activity is normal, but feeling exhausted most of the time is different. Low energy that lasts for days or weeks may sometimes be linked to anemia, heart problems, poor sleep, infections, dehydration, or vitamin deficiencies. Simple daily activities may suddenly feel harder than usual. Walking around the house, cooking meals, or climbing stairs may become unusually draining. Doctors say ongoing fatigue should not always be dismissed as normal aging, especially when it starts interfering with everyday life. 3. Breathing problems during normal activities. Feeling out of breath after intense physical activity can happen with age, but breathing difficulty during simple daily tasks should not be ignored. Walking short distances, climbing a few stairs, or even talking for long periods may suddenly feel harder than before. Breathing problems can sometimes be linked to heart disease, lung conditions, anemia, or poor circulation. Doctors often recommend medical evaluation. If breathing problems appear more often, become worse over time, or interfere with everyday activities, 4. Swelling in the feet or ankles. Occasional swelling may happen after sitting too long, but swelling that appears often can sometimes be linked to circulation problems, kidney disease, or heart conditions. 5. Frequent dizziness. Feeling dizzy regularly may increase the risk of falls and injuries. It can sometimes be connected to blood pressure problems, dehydration, or medication side effects. 6. Chest discomfort. Pressure, tightness, or pain in the chest should never be ignored. Doctors say chest discomfort may sometimes signal heart-related problems. 7. Sudden confusion. Confusion that appears quickly can sometimes be caused by infections, dehydration, low oxygen levels, or reactions to medication. 8. Changes in walking. Walking more slowly, dragging the feet, or losing balance more often may point to muscle weakness, nerve problems, or neurological conditions. 9. Loss of appetite. Eating much less than usual for long periods can increase the risk of weakness, malnutrition, and unintentional weight loss. 10. Memory problems that worsen over time. Occasionally, forgetting small things can happen with age, but memory problems that continue getting worse deserve attention. Repeatedly forgetting important conversations, appointments' names, or familiar places may sometimes point to cognitive decline or other medical conditions. Family members are often the first to notice these changes because they happen slowly over time. Doctors recommend early evaluation because some causes of memory problems may be treatable, especially when caught early. 11. Trouble sleeping through the night. Sleep patterns often change with age, but waking up constantly during the night or struggling to sleep for long periods can affect both physical and mental health. Poor sleep may sometimes be connected to stress, medication side effects, sleep apnea, depression, or chronic pain. Lack of quality sleep can also increase fatigue, memory problems, and fall risk during the day. Doctors say healthy sleep becomes even more important as the body ages. 12. Frequent falls or balance problems. Falling is not always a normal part of aging. Balance problems may sometimes be linked to muscle weakness, inner ear conditions, poor vision, medication side effects, or neurological disorders. Even one serious fall can lead to fractures, reduced mobility, or long recovery periods. In older adults, doctors often encourage balance checks and strength exercises to help reduce fall risk. 13. Changes in bathroom habits. Ongoing constipation, diarrhea, blood in the stool, or changes in urination should not be ignored. These symptoms can sometimes be linked to digestive disorders, infections, dehydration, prostate problems or other medical conditions, needing the bathroom much more often than usual, may also become an important warning sign. Doctors recommend medical evaluation when bathroom habit changes continue for weeks or become painful. 14. Hearing or vision changes. Gradual hearing loss or blurry vision may increase isolation and accident risk. Difficulty hearing conversations or seeing clearly can sometimes affect memory, balance, and confidence during daily activities. Regular hearing and vision checks may help detect problems earlier and improve quality of life. 15. Persistent pain. Pain that continues for weeks or months should not automatically be dismissed as aging. Ongoing back pain, joint pain, headaches, or abdominal pain can sometimes signal underlying medical issues that need attention. Pain may also reduce mobility, sleep quality, appetite, and independence over time. Doctors often recommend evaluation when pain becomes constant, worsens gradually, or starts interfering with daily routine. 16. Ignoring symptoms for too long. Certain health problems become harder to treat when warning signs are ignored for months or years. Paying attention to ongoing symptoms early may help older adults stay healthier and more independent longer. 17. Bruises that appear easily. Bruising, more often than usual, can sometimes happen because the skin becomes thinner with age, but frequent or unexplained bruises may also be linked to medication, side effects, vitamin deficiencies, or blood-related conditions. Doctors recommend paying attention if bruises appear regularly without clear injuries. 18. Numbness or tingling in the hands and feet. Pins and needle sensations that happen often should not always be ignored. Numbness or tingling may sometimes be connected to diabetes, nerve damage, poor circulation, or vitamin deficiencies. When these symptoms continue over time, they may affect balance, walking, or grip strength. 19. Mood changes or loss of interest. Ongoing sadness, irritability, or losing interest in favorite activities can sometimes become warning signs of depression or other health concerns. Mental health remains important at every age. Doctors say emotional changes in older adults should be taken seriously, especially when they affect sleep, appetite, energy, or social interaction. 20. Trouble recovering from minor illnesses. Recovering more slowly from colds, infections, or small injuries may sometimes signal that the body is becoming weaker. An illness that once lasted only a few days may suddenly take weeks to improve. Low energy, poor appetite, weakness, or ongoing fatigue after recovery should not always be ignored. Slow recovery can sometimes be linked to poor nutrition, immune system changes, diabetes, heart problems, or other underlying medical conditions. Doctors say older adults should pay attention when the body struggles to return to normal after common illnesses, especially if symptoms continue getting worse instead of improving. Some warning signs may seem harmless at first, but paying attention early can make a big difference in staying healthy, active, and independent later in life.